Bismillahirrahmanirrahim. In this video, we will discuss the chronic granulomatous inflammation. The references are following. So, this granulomatous inflammation is a special type of inflammation in which there is cellular attempt to contain an offending agent that is difficult to eradicate. So, it can be defined as a form of chronic inflammation that is characterized by collection of activated macrophages, often with T lymphocyte and sometimes associated with central necrosis. So there are aggregates of activated macrophages that are also named as epithelioid cells, epithelium-like cells, epithelioid cells, and they are often accompanied by T lymphocytes, and there is sometimes presence of central necrosis. So whenever there is injury by bacterium such as Mycobacterium tuberculosis, fungus Histoplasma capsulatum, or indigestible foreign particle such as suture, it will lead to inability of the body or cells, phagocytic cells, to digest or clear away the inciting agent. So the inflammatory response of that is of acute nature is failed, and due to this failure of the inflammatory response, there is persistence of the injurious agent within the body that continues the acute inflammatory process that is now converted into chronic one. And whenever there is persistence of this injurious agent, there will be cell-mediated immune response, or there can be sequestration of these indigestible material within the macrophages. So they will recruit more macrophages and to help and to clear away the insulting agent. So there will be recruitment of macrophages with epithelioid cell and giant cell formation. That is termed as granuloma. The granuloma can be divided into two types. One is foreign body type of the granuloma, and another one is the immune granuloma. Inert foreign bodies such as talc that are present in tissue in intravenous drug abusers, or suture or other fibers inside the uh, tissue site of the tissue injury or wound. The epithelioid cells and giant cell opposed to the surface of the foreign body are seen, and there can be presence of foreign material in the center that can be seen with the help of polarized light. So all these epithelioid cells are surrounding the foreign particle that is lying over there. Then the immune granulomas are present in the agents that induce persistent T cell mediated immune response. And whenever there is activation of T cells by the macrophages, there is production of cytokines interleukin 2, and this cytokine, especially the interleukin 2, it activates other T cell, and there is a response that activates further macrophages and causes the release of gamma interferon. So here you can see there is presence of a granuloma, and this can also be subcategorized and as non-caseating. There is no necrosis in the within this granuloma. There are these epithelioid cells that are altered cells, altered macrophages, which have got more secretory activity. So these are epithelial-like or epithelioid cells, and there is presence of this granuloma, giant cell within this granuloma. This giant cell is having multiple nuclei. Multiple nuclei are present on the uh, one side of this cell. So it is a large cell with multiple nuclei. So in another condition, first let me erase these markings. The other type of the granuloma is same subtype of this granuloma, immune granuloma, is caseating type of the granuloma. Here now, still you cannot see the caseation right now, but here there is a large cell. So there is a presence of many of these epithelioid cells that are surrounding many of the epithelioid cells along with some lymphocytes, and there is a presence of about 40 to 50 micron diameter giant cell. Over here, these nuclei, they are arranged on the periphery. They are forming a horseshoe shape pattern, or so here you can see this is the pattern, horseshoe shape pattern, or this type of the giant cell is termed as Lange type giant cell. Lange type giant cell. So when we see the lesion or the morphology of granulomatous inflammation under the microscope, where we can see epithelioid cells, various cells, epithelioid cells, and these epithelioid cells are activated macrophages, and here they have got pinkish granular cytoplasm. And these cells have got indistinct cell boundaries, and they are like epithelium. That is the origin of their name, epithelioid. Then their arrangement is in nests. There are aggregates of the epithelioid macrophages, and there is surrounding rim of lymphocyte. Over here, this red markings, they are the lymphocyte aggregates of the lymphocytes, and if there is long-lasting granuloma, there will be rim of fibroblast and connective tissue that we are going to see later. And in the last picture, we have also seen that. So multinucleate giant cell are present I have told you that are termed as Lange giant cell, and they are formed due to the fusion of these epithelioid cells. They merge together and forming these cells, and they are large, 40 to 50 micron. There is abundant cytoplasm and many nuclei you can see. Here, this is also a giant cell. Is also a giant cell. A giant cell, some cells, they are attempting to form a giant cell. And here, many nuclei are arranged peripherally. So necrosis can be seen. As you can see over here, this is in the area of the necrosis, and it is seen in the infection by Mycobacterium tuberculosis, and this necrotic area is developed due to hypoxia and free radical mediated tissue injury. Grossly, this appears as granular and white cheesy material, but over here on the microscopy, it is amorphous, eosinophilic, granular material with loss of cellular details like this area. Then There can be non-caseating granuloma as we have seen earlier, and these non-caseating granuloma are seen in Crohn's disease, sarcoidosis and foreign body type of the reaction. There is no central necrosis seen, and if they are long lasting, there can be fibrosis and extensive in chronic or persistent condition. You may see a large area of fibrosis only if there is a chronic or persistent infection. So to summarize the microscopic features of granuloma, you can say that there is presence of epithelioid cell with collar of lymphocyte, rim of fibroblast and surrounding connective tissue and multinucleated giant cells. The types are caseating when there is presence of necrosis like this, or there can be non-caseating granuloma. So one thing to remember that these giant cells are not only present in pathologic conditions, sometimes these giant cells are also present in the physiologic condition. These are physiologic giant cell and they occur as part of normal body function. They are derived from fusion of monocyte and macrophages, and they have a specific beneficial biologic function. One example is osteoclast that are uh, the one of the cell that are associated with bone remodeling, and they are present in normal bone. They are large multinucleated cells with organized nuclei. There are 6 to 12 nuclei that are present, sometimes up to 20 nuclei may be present in these osteoclasts. So they are responsible for normal bone turnover, and their clinical significance is that they are essential for skeletal maintenance. While besides the TB granuloma and foreign body granuloma, the other type of the pathologic giant cells are Teuton giant cells and Ashkoff giant cell. So they are present in fat necrosis, Crohn's disease, TB, sarcoidosis, rheumatic fever. And when they are present, they indicate underlying pathology. Hence, they help in diagnosis of the disease. So this table is summarizing various type of the giant cell that are present in various pathology condition. Uh, One is Lange type of giant cell that is formed due to fusion of activated macrophage, and nuclei are arranged peripherally in a horseshoe shaped or ring. So conditions are tuberculosis, sarcoidosis, leprosy, and granulomatous disease. These Lange type giant cells may be present. Then foreign material can start the reaction of the macrophage against them, and in this foreign body giant cell, the nuclei are scattered or clustered centrally, and they are formed due to reaction to the suture, talcum, splinters within the wound, or implants. Teuton giant cells are lipid-laden macrophages. In these, the nuclei are central along with foamy cytoplasm, and these are seen in fat necrosis, xanthomas, and xanthogranulomas. Osteoclast we have just seen, they are normally derived from monocyte macrophage lineage, and they have got about 6 to 20 nuclei that are scattered throughout the cytoplasm, and they are important for the normal bone remodeling. These type of giant cells are sometimes present in the condition of the bone, that is giant cell tumor of the bone. In these conditions, there may be up to 100 nuclei present within a giant cell, or more than 100 nuclei may be present in giant cell. Ashkoff giant cells are modified macrophages in the heart, and they have got arrangement of the nuclei that is central or central round or ovoid nuclei, and they are present in rheumatic fever. So we have just seen the clinical significance of these granulomatous inflammation, that they are associated with some specific condition in which some may be life-threatening. And tuberculosis, TB, is a prototype infectious cause and must always be ruled out when granulomas are detected. So to summarize, the granulomas can be infectious, non-infectious, or foreign body. Bacteria, fungi, and parasites may cause granuloma formation, and especially tuberculosis, they are often caseating. Then non-infectious are chronic inflammatory type of the granulomas that is seen in Crohn's disease and sarcoidosis. They are typically non-caseating. Foreign body granuloma react to inert material, and they are usually non-caseating. So the granulomatous disease can be seen in many of the conditions. One such is tuberculosis, that is caused by Mycobacterium tuberculosis, and it has got caseating granulomas. The feature of these we have already discussed, and there can be presence of acid-fast bacilli within the lesion if stained with acid-fast stain. So Mycobacterium leprae, that causes leprosy, has also got the acid-fast bacilli within the macrophages, but these granulomas are non-caseating. In gamma, there can be a lesion that is enclosing wall of the histocytes, plasma cell infiltrate, central cells are necrotic without the loss of cellular outline. So this syphilis is caused by Treponema pallidum, and cat scratch disease, that is due to gram-negative bacillus. There is rounded or stellate granuloma present containing central granular debris and recognizable neutrophil. Giant cell in this condition, the cat scratch disease are uncommon, that is caused by gram-negative bacillus. Sarcoidosis, one of the autoimmune disease, has got uh, non-caseating granuloma with abundant activated macrophages, and the granuloma is also a feature of Crohn's disease, that is a member of inflammatory bowel disease, and it is produced by immune reaction against intestinal bacteria, possibly by the self-antigen. There are non-caseating granuloma in the wall of the intestine with dense chronic inflammatory infiltrate. Various laboratory techniques and methods are used for the detection of the detection of the cause of the granulomatous inflammation. The specialist stain are helpful in these, and the specialist stain for to stain the Mycobacterium tuberculosis, there is acid-fast stain or Zeal-Nelson stain, a stain that is used for the detection of Mycobacterium tuberculosis. Then GMS, or that is Gomori methamine stain, or periodic acid Schiff reagent stain, is used for fungus stain. The tissue can be cultured, and for it can give you the picture whether it is due to TB, fungi, or some other bacteria. Then there are molecular techniques available for the detection of the causative organism or mechanism, that is PCR for tuberculosis and other infectious agent. And there are some serological tests available that are helpful to these to differentiate between syphilis and fungal infection. One important thing to remember, that if you find a granuloma, always consider tuberculosis. Now we will discuss a case scenario to understand the pathologic basis of the lesion. In this condition, a 45-year-old man present with chronic cough, night sweat and weight loss. Chest X-ray showed upper lobe cavitated lesion and sputum analysis revealed acid-fast bacilli. So the pathological basis for this condition is presence of Mycobacterium tuberculosis that induced a chronic granulomatous inflammatory response, presence of epithelioid macrophages, multinucleated giant cells, Lange type of giant cell, caseous necrosis, and this response is mediated by T cell chronic inflammatory response. So this TB is a global health concern that is endemic to our part of the world, the South Asia, Pakistan, India, Bangladesh, Bhutan, but it is also as much common in the USA and Western world, especially in immigrants. The chronic inflammation of the TB can lead to fibrosis, cavitation, or further respiratory compromises. Thank you for watching this video. If you have any question, please write in the comment box. Thank you.